Good morning. This is Dr. Cox, our representative from Grove, giving us our weekly legislative update.
Morning, Doug. Last week at the state legislature, most of our time actually was taken up discussing the federal health care bill. Now that's kind of ironic because that's something we as a state legislature have no control over and do not get to vote on it. However, we did pass legislation allowing Oklahomans to vote whether or not they wanted to fully participate or be able to opt out of some of the mandated options. Of course, being one of only 2 physicians in the legislature, I commonly get asked what I think about the federal health care bill, and the honest opinion is, I say, I don't think it's as good as the Democrats say it is, and I don't think it's as bad as the Republicans fear it is. It's probably going to come down somewhere in the middle. And I kind of have some mixed emotions about that bill. Of course, I work not only here at Grove General Hospital, but also have some dealings with all the hospitals along I-44 from Tulsa to Joplin. That would be Pryor, Miami, Veneta, as well as Grove. And I can tell you that all of those hospitals, as every hospital in the country, we're seeing an increasing number of folks in the emergency room with no means to pay for their medical care. And hospitals can only afford to see so many free people for so long before they develop a financial strain. So maybe the bill will help that. Also, as a physician, I like for people to be able to obtain whatever treatment they need that would enable them to live longer and healthier lives, and hopefully that bill will help that. On the other hand, as a citizen and as a taxpayer, I have, just like everyone else, I struggle to make sure that I pay my health care premiums for myself and my family. And I'm not real wild about this bill that kind of mandates that I work extra hard and pay for someone else's health care premium. So I think the bill has pluses and minuses. I also have some concerns that as a small businessman myself, some of the mandates in the bill are going to increase overhead for small businesses, and I'm concerned that some small businesses in our state and nationwide may face enough financial hardship where they have to close their doors. So it remains to be seen. I have great faith in the American system, and I'm hoping that over the ensuing months and years that the good parts of the bill will rise to the surface and the bad parts will fall by the wayside. One concern as a legislator is in these times of economic hardships where our state is $1.2 billion short in our state budget, this bill will place extra people on our state Medicaid rolls and result in an extra $100 million expense annually to our state budget. The health care bill, there's been a lot of talk about the finances of it, and I think people tend to forget that, how are we going to pay for this? Well, $52 billion is going to be taken out of the Social Security system to pay for the bill. $500 million will be taken out of Medicare to pay for the bill. And then the other thing that has gotten a little publicity is that the government is taking over the student loan program. And they're going to use the profits from the student loan program to also help pay for the federal health care bill. So, there's good sides, there's bad sides. We'll just have to wait and see how it plays out.
Right. Anything else happened this week?
Well, one thing I want to mention is we did pass a bill regarding audits of our public school systems.
Really?
Every public school has an annual audit, and that is submitted to the Department of Education. But some of those audits have fallen through the cracks, and this was kind of precipitated by a school in Skytook who the superintendent's relative was the one selling supplies to the school, and they were paying $60 for an $8 CADS register and $1,500 for a $500 vacuum and things like that. And we wanted to give a little more protection to the taxpayers. So under the new law, these audits will be submitted not only to the State Department of Education, but to the state auditor and inspector, just to give a little bit more oversight. Now, fortunately, all of our school boards in Delaware, Mays County, my district, we've always had open, honest superintendents and school boards, and that's never been a problem. But Skytook is an example of why we need to be proactive.
Good.
All right, well that kind of sums it up. We'll have a busy week this week hearing Senate bills in committee and starting to make their way to the floor, and look forward to talking to you next week.
Good, thanks.
Thank you.